Good morning, good afternoon, and good evening to all joining us today from across the Asia Pacific and beyond. My name is Karma Rapten, and I'm the Regional Technical Advisor for Climate Change Adaptation at UNDP Bangkok Regional Hub, and I will be moderating today's webinar. On behalf of UNDP and our partners, it's my great pleasure to welcome you to this webinar. The human frontline, driving change in health, livelihoods, and societies. This is the fourth and final session in our pre-APAN Forum webinar series, leading up to the 9th Asia Pacific Adaptation Network Forum, to be held from 29th September to 3rd October this year. The focus of today's webinar is people at the heart of climate resilience, our health systems, livelihoods, and the social fabric that binds communities together. Climate change is not just an environmental issue, it is a human challenge that impacts how we live, work, and support each other. Over the next 90 minutes, we will hear from experts, adaptation practitioners, and government representatives who will share insights on how transformational adaptation can reimagine the systems that people rely on, from healthcare to jobs and income safety nets, and how we can design solutions that protect dignity, reduce vulnerability, and strengthen social cohesion. Before we begin, I would like to share some housekeeping notes. The session is being recorded and will be available on the APAN Forum website after the webinar. This webinar is structured with a keynote presentation at the beginning, followed by two panel discussions, one on health and society, safeguarding well-being, and the other on livelihoods and society, securing dignity and resilience. After the panel discussions, we will have some time for questions and answers. And finally, we will have the summary and closing remarks. So that's the program for today's webinar. I would also like to remind the panelists that you have approximately 4 to 5 minutes to deliver your presentation. And I will really appreciate if you could keep within this allotted time of 4 to 5 minutes. And for the participants, we would also like to hear your views and insights, as well as ask questions through the Q&A chat box available on the webinar page. While I and my colleagues will be scanning the chat and direct questions to the panelists, I would also strongly welcome our panelists to respond to questions directly into the chat as they come in. With this, let me begin the webinar by welcoming Ms. Akiko Yamamoto, Regional Team Lead, Environment and Energy, Bangkok Regional Hub, to deliver the keynote address for today's webinar. Akiko leads the team in UNDP, which provides integrated policy and program advisory services to UNDP country offices in Asia Pacific, in areas such as natural capital, climate change, energy, chemicals and waste, water and oceans, forest conservation, NDCs, and commodities. She oversees staff efforts to mobilize resources and technical expertise for catalytic investments and solutions. She supports the team's portfolio oversight in close coordination with the regional and country offices, promote partnerships, and represents UNDP in relevant corporate and programmatic initiatives. Akiko holds a PhD in environmental management and policy and an MSc in environmental engineering from Johns Hopkins University in USA. So Akiko, the floor is yours.
Thank you very much, Karma. Distinguished colleagues, partners, and friends, a very good day to you. It's a privilege to be with you here today and engage in this pivotal conversation on transformative and transformational adaptation, one that places human well-being at the very heart of climate resilience. At the outset, I would like to take this opportunity to thank the hosts of the 9th Asia-Pacific Adaptation Network Forum, UN Economic and Social Commissions for Asia and the Pacific, the Asian Development Bank, and the Asia-Pacific Network for Global Change Research, for the opportunity to deliver this keynote address at the webinar titled The Human Frontline, Driving Change in Health, livelihoods, and societies. We're gathered here today under the banner of the human frontline, not just as a thematic focus, but as a moral imperative. Climate change is no longer a distant threat, it's a lived reality for millions across the Asia Pacific. For rising heat waves and floods, to shifting disease patterns and economic instability, the impacts are deeply personal, profoundly human, and disproportionately borne by the most vulnerable. Health, livelihoods, and societies are not abstract systems. They're the lifelines of communities. When climate shock strikes, they do not just damage infrastructure, they disrupt lives, erode dignity, and fracture social cohesion. These disruptions are what we must address through transformative adaptation. It requires us reimagining the very systems that people rely on: health services, income safety nets, education, and community support in the harsh reality of climate shocks. Reactive measures alone are not sufficient. We need to realize proactive, inclusive, and systemic change. Let me highlight 3 key dimensions of this transformation. First, reimagining health systems for climate resilience. According to the World Health Organization, climate change is projected to cause 250,000 additional deaths annually between 2030 to 2050 due to heat stress, malnutrition, and vector-borne diseases. The direct damage cost to health, excluding cost in health-determining sectors such as agriculture and water and sanitation, is estimated to be between 2 to 4 billion US dollars per year by 2030. This is only 5 years from now. Health is not just a sector, it's a foundation for resilience. Transformational adaptation in health sector involves rethinking healthcare delivery systems to respond to complex climate-induced health challenges. It should move beyond incremental fixes, reimagining the role of health systems in a changing climate, and embed anticipatory, inclusive, and system change in healthcare delivery. This means integrating climate risk into public health planning, investing in community-based care, improving resilience to health facilities and supply chains, and ensuring access for marginalized populations. Second, securing livelihoods with dignity. Climate change is not just an environmental crisis. It is the biggest threat to development and increasingly causing humanitarian crisis. It threats to push over 720 million people into poverty and displace 140 million by 2050, triggering waves of climate-induced migration and deepening global insecurity. Climate migration often severs people's cultural ties to land, oceans, and traditional knowledge, leaving displaced populations vulnerable to exploitation and marginalization. We must recognize that with the loss of livelihoods, displaced people lose not only their economic assets, but their source of identity, pride, and belonging. Recognizing that, adaptation must deliver empowerment with dignity, enabling people to thrive as active shapers of their own future, not passive recipients of aid. Transformative adaptation demands systemic change, not piecemeal fixes. It calls for redesigning agriculture and informal sector structures to withstand climate shocks, while equipping communities with skills for green and digital economies. Livelihoods in agriculture, fisheries, tourism, and informal economies are under siege from rising temperature, erratic weather, and ecosystem collapse. Yet, these sectors also hold immense potential and opportunity for transformation. Adaptation must move beyond preserving jobs and income. It must safeguard human dignity and rights to shape one's future. This means future-proofing livelihoods through climate-smart practices, resilient value chains, inclusive economic models, and robust social protection systems. Ensuring dignity in the design and delivery of livelihoods promotes long-term resilience, avoids dependency, and respects human rights and avoid maladaptation. Thirdly, strengthening social systems for equity and inclusion. Social systems, education, governance, community networks must evolve to promote fairness, inclusion, and cohesion. Climate adaptation must address structural inequalities, ensuring that no one is left behind. This requires cross-sectoral collaboration, innovative financing, and shift in mindsets, from short-term fixes to long-term systemic change. A robust social protection is the cornerstone of climate justice, supporting just transition to green and more climate-resilient economies. Yet over 3.8 billion people lack social protection currently, leaving them exposed to climate shocks. There's therefore need for transformative redesigning of social protection systems to meet medium and long-term climate challenges. So more concretely, what will make all this happen? Making transformational adaptation happen, especially in the context of health, livelihood, and social systems, require a multi-layered systemic shifts. These shifts include, but not limited to, the following pillars. First, political will and leadership. Government must prioritize climate adaptation in national development agendas. Leadership at all levels, local, national, regional, is essential to drive inclusive and sustained change. Policy coherence and integration. Climate adaptation must be embedded across sectors: health, agriculture, education, finance, NDC and national adaptation plans, SDGs, and disaster risk framework. Those should be well aligned. Third, inclusive governance and participation. Locally led adaptation ensures relevance, ownership, and sustainability. Indigenous knowledge, youth leadership, and gender-responsive planning must be central. Participatory process build trust and resilience. Fourth, financing and investment. Climate finance must scale up and made accessible, especially for vulnerable communities. Blended finance models of public and private and philanthropic sources can support innovation and scale. Social protection systems need long-term funding to evolve into climate-responsive mechanisms. Fifth, data, technology, and innovation. Climate-smart health systems rely on integrated data platforms, predictive analysis, and mobile health tools. Livelihoods can be secured through digital agriculture, early warning systems, and green technology. Social systems benefit from interoperable registries, AI-driven targeting, and anticipatory action. 6, capacity building and education. Training health workers, farmers, social workers, and local leaders in climate resilience is critical. Climate literacy across sectors empowers communities to act and adapt. Lastly, monitoring, learning, and accountability. Adaptive management allows for course correction and scaling for successful models. Transparent systems for tracking progress and impact build credibility and attract investment. This webinar is a call to action, not just a dialogue. Let us use this space to share bold ideas, challenge assumptions, and co-create solutions that are as interconnected as the challenges we face. Let us remember, transformative adaptation is not about just systems. It's about people. It is about protecting lives, restoring dignity, and building futures that are just, inclusive, and resilient. I would like to conclude my intervention with 3 key messages that align to the systems and the focus of this webinar. First, health system must be climate smart, community informed, and digitally embedded to protect vulnerable populations. Second, dignified livelihoods require locally led, inclusive adaptation that value cultural ties and community agency. Third, climate adaptation must be equitable, inclusive, and rights-based, ensuring no one is left behind. Finally, let me once again thank the organizers for inviting me to this webinar, to open this webinar, and I would like to wish you all very fruitful deliberations. Thank you very much.
Thank you, Kiko, for the very thought-provoking remarks and for setting the stage for today's webinar. Thanks again for making time to be with us today. We take note of the key dimensions of transformational adaptation and the key messages that you highlighted at the end of your presentation. These messages will be very useful as we dive deeper into these topics in the 2 panel discussions that follow. So let me now, without further ado, take us to the first panel discussion on health and society, safeguarding well-being. This panel will explore how health systems and social structures can adapt in transformational ways to protect communities from climate risks while promoting equity and resilience. Our first speaker on this panel is Ms. Heather Doyle, Team Lead for Health at UNDP Asia and the Pacific. Heather is a public health and human rights expert with over 20 years of experience in program management and partnership development, focusing on health inequities, human rights, and health systems strengthening. Prior to joining UNDP, Heather served as a team leader of the Community Rights and Gender team at the Secretariat of the Global Fund to fight AIDS, tuberculosis, and malaria. Led the Sexual Health and Rights Project at the Open Society Foundation and supported health systems projects with NGOs, including the Catholic Relief Services and Medicine Sans Frontiers. Heather holds a master's degree in public health from Johns Hopkins University and a BA in international relations from the American University. I would also like to remind participants to please post your questions on the chat and request also the panelists as we go along to respond to any questions that are directed to you. So with that, Heather, the floor is yours.
Great, thank you so much, Karma. And I'm lucky to follow Kiko because she really did such a great job to set the stage. And so it's a pleasure to be part of this discussion. And, you know, Kiko really already highlighted some of the key interactions between climate and health. And maybe let me start with just reiterating or emphasizing two concepts or 2 things that Kiko said that I think are really important. One is that we need to reimagine. And I think really understanding how to reimagine and bring our imagination into this discussion and to think differently about how we're approaching adaptation and how we're thinking about this in a much bigger way. And that brings me to the second point, which is the systems approach that Akiko really highlighted. So I think, as Akiko already mentioned, we know that climate change is a health crisis, particularly Asia Pacific. We're already seeing the human health dimensions of how climate is impacting on people Deadly heat waves are now a regular occurrence. India, Pakistan, Bangladesh, Southeast Asia, we're having record-breaking heat that overwhelms health systems and directly threatens the lives of outdoor workers, women, elderly, young people. The Pacific Islands are facing the salinization of freshwater aquifers due to the sea level rise. So we're having unsafe drinking water, and even in some places where we have to actually move health facilities because they're being under threat of flooding. In Southeast Asia, we've seen intense flooding recently. You saw what happened in Pakistan again, Philippines, Thailand, Vietnam. So you have destroyed hospitals, fueled outbreaks of waterborne diseases. They're seeing a rise in vector-borne diseases that are directly climate-related. So malaria, dengue fever. I was in Solomon Islands a couple months ago and was surprised to learn that, in fact, in 2020, they were on the verge of eliminating malaria. And now they're seeing post-COVID and also post the climate change that has accelerated in the last 5 years. They're seeing a huge surge in malaria after really being on the verge of elimination. So it's not just about protecting or holding the ground, but we're actually seeing slips in terms of these problems in a health way. So I think Akiko mentioned this, but that WHO warns on 250,000 additional deaths per year between 2030 and 2050 due to the climate-related impacts, and that the heat-related mortality among vulnerable groups has surged by 68% between 2000 and 2004 and 2017 and 2021. And South Asia is the region that's the hardest hit globally. So, and maybe one other thing to mention is that while the healthcare system is definitely part of the solution, it's also part of the problem. Right now, the healthcare sector contributes over 5% of GHG emissions, primarily from the supply chain. Which there's a lot that we can do. And Akiko already mentioned about, for example, how to streamline and make more efficient supply chains. And that includes supply chains for health systems. So there are a number of things that are already happening. I think, the solutions in some ways, the technical solutions are somewhat, I don't want to say easy, but they're easy to describe. So investing in climate resilient health systems, looking at cyclone proofing hospitals, looking at greening hospital facilities and other care facilities, scalable renewable energy for healthcare facilities, enhancing disease surveillance is maybe something to really highlight, and early warning systems. And then I already mentioned supply chains. But, I think what I wanted to really focus on is two aspects of the problem, which is that while I think countries, particularly when they're looking at their plans around the national adaptation plans, increasingly they are looking at the intersection of health and those adaptation plans. But I often think what is missing is the related, very concrete and very practical financing solutions, which really drives us to a different way. And again, coming back to this imagination, a different way to think about how we finance. I think, countries are very used to coming up with their health budget, which is obviously a huge and complicated process in and of itself. But how do we actually think about intersectorial budgets, and how do we finance against those intersectorial budgets? So while I can describe what needs to happen in the healthcare sector and the health-related impacts of climate change, often the solutions and the financing have to be across sectors. And so that really drives us to a different way of thinking about the solutions, which is a whole, what I think people are often talk about, people-centered, whole of government approach. And what does that actually look like? And how can we support countries to have these governance mechanisms which will drive to coordinated solution across sectors, and also financing and the blended financing that we need? Maybe before I conclude, I wanted to highlight one opportunity which is coming in 2026, which is that UNDP and WHO through Attach are working together to launch the climate and health co-financing facility. It's been in development for almost 2 years now, and it's getting to the point of getting ready to be initiated and to launch. And I think this is a huge opportunity. Most of the implementation work will be happening in the Asia Pacific region of this facility. And it's a real opportunity to look at how we can support countries to come up with innovative technical solutions, but then also the governance and financing solutions that are really required. And so it is bringing some new resources, and I really hope some new partnerships and some new coordinated ways of working. So with that, I'm going to wrap up. I really want to again thank the organizers for organizing this discussion, and I know that there will be other opportunities towards the end of the month to come back. And I'm really I can't, while I'm speaking, look at the chat, but I'm really hope that we can engage in some discussion about what this, both the technical, but then also the governance solutions could look like, and that we can actually really reimagine together a very different and concrete and solution to something that is very time pressing and urgent in the region. So thank you so much.
Thank you very much, Heather. And also, you highlighted one very important point on financing strategy for health and adaptation. The idea of intersectoral budgeting, and also thanks for highlighting the climate and health co-financing facility that UNDP, WHO, and other partners are currently designing. So it'll be good, as we move along, to hear more on this from you, Heather. Okay, so next, I would now like to invite Mr. Legden Zed, Chief Program Officer of the Non-Communicable Disease Division and Project Director for Accelerating Mother and Child Health Program at Bhutan's Ministry of Health. His work includes environmental health, water sanitation and hygiene, and occupational safety. With over 15 years of leadership in public health, Legden has been instrumental in integrating environmental health and national policy. He has contributed to the development of national WASH standards for schools and healthcare facilities, and has coordinated multi-sectoral efforts to address environmental risk factors that impact public health. His work ensures that environmental considerations are central to Bhutan's preventive health agenda. So Mr. Legden is also an active researcher with around 15 peer-reviewed publications on topics spanning public health, nutrition, disease prevention, and health policy. So let me now invite Legden to deliver your presentation, and you have 5 minutes. Legden, over to you. Legden, are you able to come?
Sorry, I think I just muted. I'm really apologies. I just wanted to basically thank UNDP for this wonderful opportunity. So I will, since I have very limited time, maybe I'll just try to rush this. And my topic is essentially about trying to put some angle through the Bhutanese perspective. So can we go to the next slide, please? Okay, so the challenges in Bhutan. So if you know, the Bhutan is the 38th most vulnerable. Some estimates say that Bhutan ranks 38th most vulnerable globally to climate change impacts, and we have very limited adaptability. And climate change is really shaping lives in Bhutan, because I think we are facing extreme events that really affect disproportionately poor and the most vulnerable. And some of the key sectors that are involved are agriculture, hydropower, and on top of that, we have all the rising health threats like vector-borne diseases, as well as waterborne diseases, heat-related diseases, as well as agriculture. And there's also increasing disasters from climate change, whether it is gulf, flash flood, landslides, which cause a significant damage to infrastructure as well as the livelihoods. And there's a disproportionate impact, particularly to women who contribute around 55% of the workforce. Can we go to the next slide, please? So when you talk about challenges at the intersection of health and society, so basically, when we talk about climate change, we have a couple of things that is really affecting, that is really impacting health. So one is climate change in terms of glacial-like outbursts, which is caused by erratic monsoon and warmer temperatures, and which also increases the disease spread. Economic pressure, so households that are dependent on agriculture or informal work. I think this is something that is, I guess, is already known. Face a lot of economic challenges, economic loss from environmental diseases, as well as in Bhutan particularly, we do have challenging social safety nets, because we have, in terms of the most vulnerable, poorest elderly, women and children, I think we still need to work a lot on improving sociality. That next one. Next slide, please. Okay, so when you talk about Bhutan's health system, Bhutan, we are very proud of our health system, because since the 1960s, Bhutan has been focusing on primary healthcare approach, and preventive services is our go-to intervention. And as far as health is concerned, we provide free healthcare to all citizens, which is enshrined in our constitution. So healthcare model has this is basically our healthcare model. At the primary healthcare level, we have the primary healthcare centers, sub-post, and outreach clinics. Secondary, we have the district and the cluster hospitals, and tertiary, regional, and the referral hospitals. So in essence, healthcare model, we provide free healthcare across all these three different layers with a robust referral mechanism. Now, our fear is when with this climate change, I think this very important and very good healthcare model that we have may be disrupted because of the effects of healthcare. So because of the effects of climate change. So can we go to the next slide, please? Okay. So in terms of what is our approach, right? So in terms of what is our approach, when we talk about approach, now we are rethinking of trying to really improve how can we really provide redesign our systems. So I would like to admit here that I think Bhutan is still very new to this idea. Not the idea, we are feeling the effects, but very new to very new to this adaptation, and I think there is still a lot of work that is required in order to really redesign for resilience, but we are getting there. So some of the things that we are thinking in terms of our approach is we still need to strengthen our primary healthcare. So we have to focus on preventive care and community-led mechanisms, especially in remote areas, and we have to integrate climate considerations into our health planning. Second is digital health transformation, and this is something that is ongoing right now. We have the Bhutan vaccine system, the ICTG initiative, the digitalization of medical records to improve access and efficiency will definitely help with our response, as well as data keeping, and also want to integrate this climate resilience. This is using the NEWAR's early warning and alert response and surveillance system to predict and manage climate sensitivities. This is some of the three big broad areas that Bhutan is currently working on. Can we go to the next slide, please? And in terms of innovation, probably this may not be a big innovation per se, but since interventions to climate change is something that is currently ongoing, broadly, I think One Health approach is obviously a way to really go into it. Environment was not necessarily something that was focused in the One Health approach, but this is something that we are really advocating for, and now it is something that they are considering. The group that's One Health is really environment is also getting taken into consideration. In terms of climate resilient infrastructure, we are working with several agencies and also seeking funds to upgrade health facilities with energy efficient, as well as also wanted to pilot electric ambulances, as well as to ensure that our certain health facilities are resilient. And we also want to training local representative with a very specific focus on gender specific risks, community empowerment also, and also to find ways to mitigate themselves at their own at the community level. Can we go to the next slide, please? And then in terms of financing, this is something I would like to admit is a big challenge in Bhutan. And climate financing, and this is a question that I wanted to really learn from here, because whenever we talk about climate change, sometimes it gets outcompeted with other priorities, particularly for health, and because sometimes climate change and environment is not seen as a health agenda, but it is seen as an agenda for Department of Environment, say, for instance. So sometimes we do have challenges, but nevertheless, in terms of our aspiration, what we are looking for is we want to definitely, especially in terms of how do we fund for, we want to look into innovative health financing. We are definitely exploring taxation reforms, tobacco, alcohol, sugar, particularly for NCDs, and perhaps by extension we want to look into this climate change health financing, particularly to sustain Bhutan's free healthcare system. Green Climate Fund is something that we are definitely working on together with the UNDP, led by UNDP and WHO. So we are mobilizing around 5.5 million for climate resilient health systems, targeting maybe 4 health facilities for climate proofing. But at the same time, we're also looking at systems change, whether it is surveillance or whether it is capacity building or whether it is even looking at broader policy approaches. Nature for Health initiative this is our aspiration again. So we want to also look into 2.25 at least certain number of money for upstream interventions by environmental drivers for zoonotic and partnerships. Basically, we are working with the different UN agencies, particularly UNDP and WHO, to garner and leverage their expertise in these interventions. Next slide, please.
If you could
Next slide,
start
please.
wrapping, Mr. Legden.
Okay.
If you could start.
So maybe
wrapping up.
okay, so this is my last, maybe as a key lessons for Asia Pacific. I think as a Bhutan's approach, we need to have a proactive surveillance, which is very crucial. Climate resilience infrastructure. We also need to invest in climate smart workforce and community-led solutions. I think this is. I'll leave it at this. I'll leave it at this. So thank you for the opportunity. Okay, thank you. I think, Karma sir, you're muted.
Yeah, sorry. Thank you, Mr. Legden, for that very interesting presentation and the kind of approach that the government of Bhutan is taking in terms of making systemic changes in the health delivery system. Let me now move to Dr. Samir Kumar Adhikari from Nepal. Dr. Samir is a senior health administrator in the Ministry of Health and Population, Government of Nepal. Dr. Samir is a seasoned public health expert with a master's degree in public health and a master's in clinical psychology. Dr. Samir has led critical national responses to health emergencies, climate change, and health, and played a key role in multi-sectoral coordination and international health regulations. Recognized with prestigious Nepal government awards and with many publications to his credit, Dr. Samir is well known for his leadership in crisis management and impactful contributions to Nepal's public health system. So, Dr. Samir, the floor is yours.
Thank you, Karma sir. Thank you. Good afternoon, good morning. It is my pleasure and honor to be part of this webinar today. I will briefly share Nepal's experience in building a climate resilient health system, highlighting our approaches, financing, and lessons learned. Next slide, please. In Nepal, climate change is already affecting public health in multiple ways. To address this, we have tried to redesign our systems with a long-term vision. We tried evidence-based planning. We carried out vulnerability and adaptation assessment in 2015 and again in 2022. We identified some climate-sensitive diseases, including vector-borne, waterborne, respiratory, and other illnesses. Based on these evidences and different experiences, we prepared Health National Adaptation Plan 2020-30 and to 2025 2013 to 2030. After implementing first round of HNAP, the current one is the second round. This plan emphasizes advocacy, planning, capacity building, surveillance, climate resilient health facilities, and stronger research and policy frameworks. We have also conducted a baseline assessment of greenhouse gas emissions from the health sectors. This helps us to monitor and guide low carbon health system development. Our vision is simple but ambitious: to ensure that hospital and health facilities remain functional even during floods, heat waves, and other extreme events, with access to clean water, sanitation, renewable energy, and resilient infrastructures. And importantly, we are working across sectors linking health with agriculture, disaster risk reduction, and social protection. Next slide, please. To operationalize this vision, we have adopted innovative practices as well. We developed a dedicated web portal on climate change and health, which serves as a knowledge sharing platform. At the policy level, a multi-sectoral coordination section has been set up at Ministry of Health and Population to connect health with other ministries. Health is also embedded in Nepal's nationally determined contributions, which is a major achievement for mainstreaming health. On the ground, we are building capacity of frontline health workers through the national health training centers. Local adaptation plans and community engagement ensures that solutions are tailored to local context. Internationally, Nepal made a strong commitment at COP26 to build climate resilient and low carbon health systems. We have already started strengthening resilience in selected health facilities as pilot. Next slide, please. Of course, none of this possible without financing. From the national side, the Ministry of Health and Population allocated funds through the annual work plan and budgets. We are also fortunate to have strong international support. WHO and UNDP have supported a GEF-funded project on building resilience in low Asian least developed countries, though these supports are not sufficient but important for us. We are currently working with the Green Climate Fund, UNDP, and WHO on a climate and health co-investment facility program, which is in the pipeline. In addition, development partners such as IPAS, KFW, and UNOPS are supporting initiatives, especially in strengthening climate resilient health facilities and linking climate with reproductive health. So our approach is a mix of domestic investment and international collaborations, ensuring both ownership and sustainability. Next slide, please. From these efforts, a number of lessons emerge. First, health must be mainstreamed in climate policy if we want to achieve real adaptation. Second, early warning systems that link disease surveillance with climate data are crucial for timely response. Third, capacity building at all levels, from national institutions to local health workers, is essential for sustainability. Fourth, framework like the vulnerability and adaptation assessments and the health national adaptation plan can guide not only national but also regional adaptation efforts. And finally, multi-stakeholder partnerships, targeted financing, and international knowledge exchange remain the backbone of success. Next. Next slide, please. To conclude, Nepal's journey shows that building and climate resilient health system is both a challenge and an opportunity. While our resources are limited, our commitment is strong. By combining evidence, innovation, financing, and partnerships, we are working to safeguard the health of our people against the growing risk of climate change. I will be happy to clarify or explain in details if any queries is there, and your valuable feedbacks are highly appreciated. Thank you very much for your kind attention. Thank you. Over to you, Karma.
Yeah, thanks, Dr. Samir, and thank you very much. Thank you very much for keeping somebody's microphone is on. Can you unmute? Yeah, okay. So thank you very much, Dr. Samir, for your very interesting presentation and in particular for keeping to your 5 minutes allotted time. Since we are running a bit behind schedule, so this is the end of the first panel session. We will have the next one, and then after that, maybe we can have the Q&A together. So the panel for this session, please remain online until the end of the webinar. So let me now go to the second panel, which is on livelihoods and society, securing dignity and resilience, where we will discuss how adaptation actions in climate vulnerable sectors such as agriculture, fisheries, informal economies, tourism can empower people to thrive with dignity, safeguard livelihoods and identities while preparing for a resilient future. So for this panel, our first speaker is Ms. Samar Taha. She is the Regional Technical Specialist on Climate Change Adaptation with UNDP at the Bangkok Regional Hub. Samar has over 19 years of experience in climate change adaptation, disaster risk reduction, and environmental management. Before joining UNDP, she also worked as a program policy officer on climate change adaptation in DRR in WFP. So Samar, the floor is yours.
Thank you, Karma, and good morning to all of you online. First of all, allow me to remind ourselves that we work in a region that is home to 60% of the world's population and some of its most climate vulnerable communities and ecosystems. So impacts of climate change that Akiko mentioned in her opening remarks are affecting natural assets and human capital for tens of millions of people whose livelihoods depend on natural resources. And this includes people who work in agriculture, fisheries, and tourism sector, among others. So, of course, when we work towards transformational adaptation across various contexts, we will automatically create livelihood co-benefits through improving ecosystem functionality and generating a range of other system-based co-benefits. But we often strive to design a long-lasting strategic livelihood intervention as part of our adaptation programming. This is to address national priorities and to also reduce social and economic vulnerabilities. So I compiled a few lessons and reflections from UNDP's experience in working with livelihood interventions in different settings, be it crisis settings or development settings. And I'm sure that you can also draw parallel from your experiences on these reflections. So first one is a very honest reflection about the fragmentation of income generation schemes that you often find in projects. And these schemes come with short-term benefits and have proven to be insufficient for sustainably addressing scale and depth of socioeconomic vulnerabilities. So such interventions are only acceptable as the aftermath of a disaster and to inject cash into communities for disaster recovery efforts. But long-term livelihood support must be nurtured through improving enabling environment, policies, the incentives and partnerships that allows for experimentation, innovation, scale up, and transforming systems. For example, we have a project, a GCF project, aiming to strengthen the adaptive capacity of smallholder farmers in central highlands and south center coastline of Vietnam. The support of smallholder farmers here is focused on enhancing water security for agricultural production, along with having a supportive package of climate resilient agriculture, capacity building, access to climate information, finance, and markets. The second point is about the types of innovations that is acceptable and would be employed. Innovation in livelihood is not just about digital tools or high-level or high-tech solutions, although these are critical and maybe revolutionary in some markets. But then it's equally about social interventions and employing indigenous practices and new ways of organizing livelihoods. So for example, in Mongolia, reintroducing some of the traditional community-based rangeland management practices combined with digital advisory services has helped pastoralists coordinate and rationalize pasture use to implement sustainable water resource management as well. The third reflection is very important. It's about alternative financing schemes. So the reality is that climate adaptation will remain underfunded, even without accounting for the recent change in the donor landscape. And we have to come to terms that funds that flows will be always below the needs of the demand for vulnerable communities. So when climate funds are pushing for diversification of financial instruments, this should trickle down to also livelihood action. So we need to consider coupling grants with concessional loans, risk pooling mechanisms, and blended finance to unlock these resources at scale. And this should be done in full partnership with private sector and with national development banks. At the same time, domestic financial systems must be reoriented to integrate climate resilient income generation schemes and social protection systems. Our role here as development actors is a convener to help build these systems and empower local actors, ensuring equitable distribution of resources. I'll have an example from a project that we're designing with Jeff in Cambodia, where we're aiming to enhance climate resilience of communities in Tonle Sap Basin through integrated watershed management that sustains local livelihoods and societies. So in this project, we're designing sustainable blending finance, and we're trying to find mechanisms of diversifying the value chains and increasing climate resilience and for livelihoods that is dependent on natural resources. So I'll stop here. And I hope that we can start a discussion about what's possible and what's needed to support long-lasting livelihood support. Right. Thanks.
Thank you. Thank you very much, Samar, for giving us, UNDP insights on transformational adaptation and bringing about shifts in livelihood system. So let me, in the interest of time, move to our next panelist, Mr. Mirza Shaukat Ali. Mr. Mirza Shaukat Ali is the Director, Climate Change and International Convention in the Department of Environment, Government of Bangladesh. He has more than 27 years of work experience at the Department of Environment in the field of environment and climate change. Mr. Shaukat has a BSc Honors and MSc in Geography from Jahangir University, Bangladesh, and MSc in Spatial Planning and Regional Development Planning from Dortmund Technical University and University of the Philippines. He also served as Climate Change Adaptation Specialist at the Comprehensive Disaster Management Program Phase 2, which was funded by UNDP, I believe. So, Mr. Shaukat, you have the floor and you have approximately 5 minutes for your presentation.
Thank you very much. Thank you, Mr. Karma, for introducing me. In the interest of time, let me focus for my presentation, and I believe 5 minutes is very short. I shall try to abide by the time limits. Thank you. So I shall try to discuss on our country vulnerability. Can you go to the next slide, please? As you are aware, Bangladesh is one of the most vulnerable countries in the world, and this is from our National Adaptation Plan. We have actually identified 14 hazards. You can see from monsoon flash, flash floods, drought, salinity, storm surge, whatnot. Every kinds of hazards you can find in Bangladesh, and that's why a small country with a huge population is one of the most vulnerable countries in the world. Next slide, please. So in our NAP, we have identified 8 sectors where actually we consider 6 of the sectors are highly vulnerable, like water resource, disaster, agriculture, fisheries and livestock, urban areas, ecosystem, wetland and biodiversity. And when we propose for the solution, we included policy institution, capacity development, research and innovation. So these are the 8 sectors we have considered in our National Adaptation Plan. We have also considered health and gender as cross-cutting sectors. Next slide, please. So if we can implement interventions that we have identified, 113 interventions in our national adaptation plans, it can benefit, it can actually transform the country to a great extent. I mean, resilience of local community can be enhanced to a great extent. So you can see some of the benefits, like protection of 1.1 million hectares of croplands, 10.3 million tons of rice production will be increased, about 4 million fisheries dependent households will be protected, a total of 30 million people of 43 urban areas will be benefited from improvement of drainage and other facilities. Tree crop coverage will be increased by 5% of the country through mangrove plantation, and annual deaths by climate-induced disasters will be reduced to a great extent. Can you go to the next slide, please? But the challenge is investment plan. If we look into the investment plan, 113 interventions will be required, $230 billion over the next 27 years, from 2023 to 2050. And you can see water resources will be required the highest allocation, 52% of the total allocation. And then agriculture, urban areas, policy and institutions, disaster. So can you go to the next slide, please? So we have proposed that majority of the resources will come from domestic resources. We have a huge, allocation from our national budget. About $4 billion we provide as country allocation as part of annual development program, which is aligned to the climate change. So that will actually provide the largest chunk of the climate resilient initiatives, but we haven't forgot the private sector investment. So we have considered about 5 to 7% of the investment will be coming from the private sector. Next slide, please. And also with the support of the development partners, we are working to actually support some of the local initiatives like climate resilience. So Asian Development Bank, along with UNDP and other development partners, actually has formed a Bangladesh Climate Development Partnership. This consortium is going to provide support, initially $1 million technical assistance to develop some web portal and also secretariat. Ultimately, they will develop a roadmap and try to implement most of these activities identified in the NAP. Next slide, please. And now I will try to focus some of the projects that we are implementing, which will show where actually we are trying to make the transformation. So community resilience is at the heart of Bangladesh National Adaptation Plan. Almost all the climate change projects are gender responsive and trying to ensure youth engagement. And most of the beneficiaries of the project are women-headed households. The projects are focusing on ecosystem-based approaches to adaptation, and locally led adaptation approaches when it comes to enhancing the resilience. Next slide, please. I will focus on this project specifically, adaptation initiative for climate vulnerable offshore small islands and river and shorelines in Bangladesh. I'm the project director of this project, funded by Adaptation Fund and supported by UNDP. Next slide, please. I'll just focus on the main outputs that this project will be actually, providing support. There are two unions we have targeted, one riverine island, one inland shoreland. Actually, this is the lowest, union is the lowest administrative unit in Bangladesh, and we're going to provide 300 climate resilient houses, 30 solar nanogrids installed, or 132 households will be provided to ACDC system, 10 dual purpose cluster houses, and then 24 kilometer of embankments. And we are going to provide 8 mobile floating ambulances, 6,500 people will be provided with climate resilient livelihoods, and 7,500 farmers will be trained with climate smart agricultural technologies, 4 solar cold storage, and 2 adaptation learning centers. And we hope if we can implement this project properly, because we are in the mid stage, and hopefully we'll be able to implement, this will make a transformative change in the local community. Next slide, please.
Can you please start wrapping up?
Next slide, please. Yeah, I shall shorten. These are the beneficiaries we have identified. Next slide, please. These are the houses that we are going to provide. Next slide, please. You just skip one after another. Yeah, go ahead. Next slide. Next slide. Yeah, next slide, please. These are the cluster houses. These are the adaptation learning center. And next slide, please. This is, I want to share this last slide. Actually, our local government division has already identified climate risk-based vulnerability and has developed a climate vulnerability index. And based on this climate vulnerability index, actually, we are going to allocate resources to these local government units. At least 25% of the allocations will be based on this climate vulnerability index. And local level planning is now being linked with the National Adaptation Plan following the LLA principle. Next slide, please. These are the three projects. I'll just name the names. Then you can understand these are all, providing support to the local community, integrating climate change adaptation into sustainable development pathways, ecosystem-based management in ECAs, ecological critical areas in Bangladesh. There are 13 ECAs, and community-based management of Tangwar Hawar wetland ecosystem. So all these projects actually are focusing the local people with transformation and focusing on their well-being. So with that, I would like to conclude. Thank you very much for giving me the opportunity and discuss in this great forum. Thank you very much.
Okay, thank you, Mr. Shaukat Ali, for your very interesting presentation and for presenting Bangladesh's experience on how locally led adaptation is leading to transformational shifts and putting people at the center of development. Very interesting. Thank you again. And now I move on to our final speaker for today. Which is Mr. Timothy Nakalevu, Climate Change Adaptation Officer from the Secretariat of the Pacific Regional Environment Program. Timothy is the Climate Change Adaptation Officer for SRAP, and he has over 10 years of experience working in the Pacific on the climate change adaptation, land use planning, community mobilization, and more recently supporting Pacific Island countries in the development and review of the national adaptation priorities. So Mr. Timothy will present, his experience and SPREP's experience working in the Pacific SIDS and how adaptation leads to transformative pathways for income and social stability. Mr. Timothy, the floor is yours.
Thank you. Good morning, Karma and the team that are leading the the webinar. Thank you for the opportunity as well to be speaking alongside the other panel members on this topic. So, as you've alluded to, my name is Timothée Nakalim, the Climate Change Adaptation Officer for SPREP. But also in my spare time, I do like to dabble a bit in a bit of farming. So in the topic that we were given, how livelihoods in climate vulnerable sectors such as agriculture can have the potential to transform, to protect income stability, provide income stability with also social stability. Yeah? So I thought I'd talk on this from the agriculture sector. So looking at it from the agriculture point of view. So how agriculture can transform to protect income and also social stability through ambitious and transformational adaptation. So in the Pacific, agriculture is quite an important sector for us, especially as it is one of the backbones of most of our small economies. But with the increasing impacts of climate change, this is now under threat, and there is a need for more ambitious and transformational adaptation. So I think one of the panelists touched on it a bit earlier on. The vulnerabilities in with regards to saltwater intrusion, to heat stress, to the plants and crops, extreme weather events. These are all the climate vulnerabilities faced by our people in the agriculture sector. So in terms of its importance, the percentage work that are employed in the agriculture sector in Vanuatu, 43% are employed by the agriculture sector. In Papua New Guinea, 38%. And Solomon Islands, you see the different percentages there that are employed in the agriculture sector. So for Fiji, it's around 29%, Tonga 27%, and Samoa 20%. To illustrate that's a bit more, in Fiji, this is around 161,000 people. And in Samoa, this is around 39,000 households. So so agriculture is quite an important sector for us. Not only for income, but also for daily sustenance and also, the food that we eat every day. So in terms of, sorry, let's go on to the next slide here. So in terms of transformational pathways for income and also social stabilities, one of the ways, the first one that I've highlighted is on income diversification for our agriculture, for people engaged in the agriculture sector, through value addition, agro-tourism, agro-rugby, value chain enhancement, and then strengthening of market linkages. A new one that's there on the screen is agro-rugby. So rugby is a huge thing here in the Pacific, and this is one of the new concepts that have come about probably last 2 or 3 years now. Agro-rugby. So the concept is when so players they have training in the morning and in the afternoon. So during the day, this is when they will be engaged in agriculture. So whether it's marketing, maintenance, planting, and all these things. So that is all covered under the value chain enhancement is around ensuring that the market pathway is quite open. So there's no blockages within the value chain from getting your products from your farms to the market, and also strengthening market linkages, both domestically and with the international markets. With the international market, there's a lot of certification, there's a lot of cost to it as well. So ensuring that we meet and diversify, but meet as well those kind of criteria that will enable us to open up those markets. Second one is on technology and innovation, ensuring that our farmers have the most updated information and updated technology that is available. So, for instance, mobile apps for weather forecasting, for market prices, uh, crop advice, solar coal-powered storage, and also climate resilient and also climate tolerant species of crops that we can grow. This will ensure that we are working towards not only planting crops but planting crops that will be able to withstand the impacts of climate change. Agroecology, both agroecology as a science, being farmer-led research, it being a practice, farmer-to-farmer learning, and also the third main one is the farmer movements, creating when people bind together, creating movements, they have a much bigger voice in the market space, in also mobilizing resources as well as gaining support from governments and all that. So that is this one. The other point I wanted to highlight there. And the fourth, last one there is on policy and institutional support, and gathering, uh, getting our governments to go behind to support our farmers, our fisher folks. So through subsidies for farmers, climate insurance schemes, also access to microfinance. So these are the kind of things that for me would transform the agriculture sector to ensure that we have income and also social stability. Thank you, Kama. That's it from my side.
Thank you, Timothy, for your very interesting presentation. I was especially intrigued about your rugby idea. We want to learn more about that. So you can come to the forum in the end of September to tell us more about that. Thank you very much. Okay, so now we come to the end of the panel sessions. Dr. Samir, I saw one question directed to you on chat, on Q&A. So if you could respond to that, or if you want to come in right now, give a very short response to this, that's fine also.
Thank you, Karma sir. I think this is not the question. This is just feedback that Nepal took the lead in health and climate change in 2018 in Kathmandu, and an international conference was held in the subject where I stated the safe water supplies are affected by floods. That's true. In case of our country, our context, that this is the flood season, and during the flood season, basically the water sources are being affected. Even right now that we have been facing difficulties in one of the metropolitan city with the water supply, that we are having outbreak of cholera.
Dr. Samir, sorry to interrupt. Yeah. The question that is on the Q&A is, can you please share how you engage the private sector in the HNAP design and implementation?
Oh, thank you. I missed that question. I did not see. Yeah. Thank you, Karma sir.
No worries.
Basically,
can you please be very brief, because we need to create time for other questions as well.
Thank you. Of course. To engage the private sectors, that we have one multi-sector committee in the Ministry of Health and Population, so which represent different stakeholders, and to engage private stakeholders, that during any document preparations we provide in public domain to get their feedback, as well as during implementation we invite them and we get their feedback and revise accordingly during implementation as well.
Okay, thank you very much. So I don't think there are any other questions that we haven't addressed on Q&A and on the chat. So let me ask a very general question to the first panel members on health and society. You have all highlighted different approaches to strengthening health and social systems, right? From your perspective, what is the single most transformative lever we must prioritize to make the systems climate resilient? So any one of you can come in, please. Heather, Dr. Samir, or Mr. Legden. Yeah, please unmute yourself and then come in, whoever wants to respond to that question.
Well, I'll go ahead and start. And
Okay.
yeah, maybe, and since I'll start, maybe I'll also break the rule and maybe I'll just mention two, if you don't mind.
Sure.
And so
Okay.
one is I kind of spoke to, which is I really, in terms of leveraging, I really think countries should be applauded for the efforts that they've put into, and it came out in the presentations, that the efforts that they've put into really doing, I think, the planning piece, right? And coming up with the national adaptation plans, health components of national adaptation plans, identifying the priorities for health in the NDCs. And I think there's been a lot of thinking and thoughts that have gone into that. And as I kind of spoke to this bit in my presentation, others have spoken to it now as well, which is now to really, I think, bring the financing piece to that. And I think that is me, and really trying to be, I think the word innovation is really overused. But in this case, I will go ahead and use it. And I think we do need to be innovative in how we're going to finance the solutions that countries are identifying. And the second thing I wanted to just mention is the early warning systems, and maybe in terms of the leverage piece, and I think also, again, particularly Bhutan, but other presentations spoke to this, which is that it's not that difficult to develop an early warning system. It's very difficult to deploy an early warning system successfully. And so I think, there's been so much investment in community health systems. And so how do we link, I think maybe the leverage piece is how do we link up these investments and these systems between the significant investments that have been made in early warning systems and then a community response to that. So how do we actually make those things work together? And I would say that if we are able to do that and leverage those investments and those systems to speak to each other, that could be very powerful.
Thank you. Thank you very much, Heather. Very interesting. Anyone else want to come in? Mr. Legden?
Yeah,
Dr. Amir? Yes.
maybe just my small perspective
Very
on that.
briefly, please.
Yeah. So regarding what could be really important, particularly in terms of Bhutan, is because one of the greatest challenges right now is trying to link, let's say, climate change or environmental health initiatives with that of health-specific sort of like health interventions, because sometimes our interventions are seen as cross-cutting. Supposing we, let's say, design interventions for zoonotic diseases based on climate change, but then they think this is not the health initiative. Maybe this is not the environment health. This can be easily be given to zoonotic disease. If you talk about water wash, say for instance, it's a wash sector that is involved. So the point that I'm getting at is, in order to really do this, we need to look into this more data. We need to find better data systems, better sort of like integrated indexes to really define what is the exact high impact interventions for climate change and environmental health, and then only go forward with this. So that is one of the innovations, that is one of the systems that we really need right now, and this is something that we are trying to work out in Bhutan. Thank you.
Thank you. Thank you. Okay, so now let me move on to the second panel. A follow-up question for you guys. We've heard about transforming livelihoods in vulnerable sectors like agriculture and fisheries, right? What practical steps are needed to scale up these examples so they benefit entire communities, not just pilot projects? Anybody wants to come in from the second panel? I'll give preference to Bangladesh and SPREP first. Samar, I know you're itching to say something, but hold on.
So could you repeat that again, Karma, please?
Yeah, so what practical steps are needed to scale up the examples that you have provided so they benefit entire communities, not just pilot projects.
Okay, I'll take a stab at it, but I think one of the critical enablers of transformational adaptation. One is the support, I guess, from governments in terms of creating enabling environments, and the other one is the other one is probably the availability of also resources to actually carry out this large scale transformational adaptation.
Okay.
Otherwise, it will still be on a piece by piece basis. Thank you.
Okay. Thank you. Thank you. Samar, you want to come in briefly?
Yeah, thank you so much. I think the points and the reflections that I touched upon answers your question in a way, but I want to also refocus on engaging private sector and like putting out the right enabling environment for private sector to incentivize them to invest more in climate resilient. So climate resilient livelihood or climate resilient infrastructure. And here we are unlocking financing that comes from development banks, that comes from actual private sector and domestic funds. Yeah, thanks.
Thank you, Samar. Thank you very much. And finally, one final question for all the panelists. If you had to give one piece of advice to policymakers preparing national adaptation plans, what is the single most important action they should take to put people at the center of climate adaptation? Just give me a one-word response. Samar, you want to go first?
Can you come again, please, with the question?
If you had to give one piece of advice to policymakers preparing the NAP, right? What is the single most important action they should take to put people at the center of climate adaptation?
The word is justice, I think.
Okay, great. Great. Anyone else
Just one.
before we wrap up?
Maybe I would add inclusive.
Inclusive, justice, yeah, similar. Okay, anyone else? I'll give everybody a chance this time.
Maybe help financing.
Financing, great. Anybody else?
I think the strong evidence and advocacy.
Evidence and advocacy. Okay, thank you. Okay, so please continue to put your questions in the Q&A, participants, and we'll try and respond it. Okay, so with that, then we come to the end, and I'll now hand over the floor to my colleague, Muyeye Chambreo, Climate Strategies and Policy Specialist with UNDP. So I'll ask him to summarize briefly the proceedings of today's webinar. Over to you, Muyeye.
Well, thank you very much. Yeah, good. Thank you very much, Kama, for this opportunity for me to wrap up a very interesting webinar. And as Kama is rightly said, my name is Muyeye, and I didn't have notes prepared ahead of this because I was depending on what the panelists were going to say. So you'll see me referring to a few of my notes on the table here. But I would really like to thank everybody for their contributions. And what this webinar set out to do was to shape and inform the main APAN forum, which is coming later on in November, whose theme is on transformational adaptation. And the focus of this particular webinar is on the human frontline, looking at health systems, livelihoods, and societies, how they come together. And right from the beginning, from the keynote, as well as the contributions from the experts and the practitioners, we were challenged to consider the threats of climate change from all those perspectives. And it is very clear that we cannot ignore the impacts of climate change on society through the health sector, through livelihoods and related sectors. But three things that came out from the beginning relate to how health systems must be climate smart, community informed, digitally enabled to protect vulnerable communities. And we're also looking at dignified livelihoods requiring locally led, inclusive adaptation that values cultural ties and community agency. And climate adaptation must be equitable, inclusive, rights-based, ensuring no one is left behind. So in the course of the conversation, a few things came up. The first one is that there is a lot that is already going on that needs to be built upon and scaled up for this to be realized, for transformational adaptation in these sectors to be realized. There's a lot going on developing partnerships for implementation, as we heard from Bangladesh. We also heard that there are platforms and initiatives that are being developed for financing, integrating health and climate change facilities that have been mentioned, being designed, and also digital health systems as a basis for integrating climate change, and a lot of projects that are being developed by a whole range of actors, including governments, development agencies like UNDP, WHO, and so on. And a lot of planning taking place at the country level, which is great. And from these, we are learning a lot of things. Context is important. We're looking at crisis and non-crisis situations, coastal systems, highland systems, and agricultural systems, and their importance for ensuring that communities are at the forefront of transformational adaptation. The need for data has been highlighted, multi-sectoral engagement and targeted financing, policy integration, and working in systems. And this needs to be reimagined, and we have learned from countries like Bhutan, Bangladesh, and Nepal, and also from the Pacific on that. And transforming systems for people is very important rather than just doing adaptation. And therefore, empowerment of local people has come out very strongly. Local people and groups for local action. We have spoken about policy integration and partnerships with local governments, NGOs, and the private sector. And some of the policy levers that have been highlighted in order to facilitate and support transformational adaptation include, we know the NAPs, but we have learned quite a lot about how these are being applied in different sectors, such as the health NAPs in Nepal, and also the need for tools for policymakers to prioritize and act and take actions that make a difference. And tools for local level planning, targeting subsidies for transformation, and enhancing access to microfinance. That has come out very strongly. And with all these and other things that have come out in the webinar, there are areas that we need to deepen, and I'm looking at this from the point of view of going to the main forum itself. So the conversations at the main forum need to deepen on a number of things that have come up in this particular webinar. These include justice and inclusion in transformational adaptation, and how to integrate them in the design of adaptation actions. Systems approaches, we need to deepen our engagements and our discussions on these. Actualizing or reimagining finance for intersectoral solutions. There is need to delve a lot deeper also on nature solutions for communities and for health. And the need for data has been highlighted, and we need to move beyond the projects that are happening on a smaller scale through scaling up. How do we do this, and how do we build on that? So really deepening these perspectives at the forum itself is something that we look forward to, and hoping that the participants and the panelists here will come in and contribute in an even deeper manner. And with those few perspectives, let me thank the panelists. I will not mention all of them by name. And also thank our keynote speaker. She may not be here anymore, but she did a great job in setting the scene. The moderator, my colleague Kama, has done a great job to make sure that we had an engaging conversation, and we were on time. And those our colleagues in the background who set up this whole webinar, very great. And also want to thank the hosts of APAN Forum who are putting all these things together. The UN Social and Economic Commission for Asia and the Pacific, the Asian Development Bank, the Asia Pacific Network for Global Change Research, and others who are behind all this, this work. And the participants who have been actively listening and also putting questions in the Q&A. And also want to thank the team that put together this webinar, including those in the APAN Secretariat and UNDP. And with those a few remarks and highlights, would like to thank everybody and wish everybody a great day and a great week till we meet at the APAN Forum. Over to you, Kama.
Thank you. Thank you, Muyeye, for the very succinct summary of the proceedings. And on my part, as the moderator of the webinar, I would also like to thank all the speakers, panelists, and participants for such a very rich discussion today. We've had very powerful reflections today on health, livelihood, societies, and the interconnectedness of these systems. So this is a timely reminder that climate change is fundamentally a human story. So by placing people at the center of adaptation, we can create societies that are healthier, more resilient, and more just. So on behalf of UNDP and our partners, I would also like to sincerely thank our keynote speaker, our distinguished panelists, and all of you for your engagement. Your insights today will also help shape the upcoming 9th Asia Pacific Adaptation Network Forum, and we look forward to continuing this important conversation there. With that, I officially close today's session. Thank you once again, and wish you a very good day. Thank you.
Thank you, Karma. Take care.
Thank you.